Hey everyone, it's Tisha. I just want to hop on quickly and do a coronavirus update. I know I haven't done one in a few weeks. I've been extremely busy responding, helping doctors get started, doing telemedicine. And so I just wanted to share a few things that have come my way that I think may be helpful to others. One, the government has been saying for months that free testing is available without providing any resources to private practices who see many of the patients every day. And now, finally, months later, they have released a link for private practices to be able to be reimbursed. So, if you are uninsured and would like to get tested for COVID, either because you have symptoms now or have had symptoms in the past and are worried that you may transmit it to others, you can get tested for free if uninsured. If you have insurance, it depends on if the doctor you see is in network with your insurance. Insurance companies are attempting to make it easier for doctors to get in network, but they have not made it that easy. Okay, so you still have to apply, you still have to wait for them to respond. So if you ever look at your insurance and you see in network, out of network, of course, out of network is usually higher price out of pocket versus free in some cases, no copay. So just keep that in mind. So free testing is available and through rodocs.com. If you see the flyer and you support me and you support Rodocs, share it. There's absolutely no reason not to share it, right? We cannot, as a community, say, oh my God, they need to test more minorities. We need more testing centers. But when we come across free resources, we don't pass that information along. If you're not passing the information along, then you are as much a part of the problem as everyone else. And I guarantee you, you know someone that's uninsured. Many self-employed people, that means beauticians, right? Your nail technician, your makeup artist, your barber, your realtor, your lawyer may be uninsured. How do I know this? Because I have people in my network in all of those professions who see me, who pay cash because they don't have insurance. So now here's the opportunity for them to have free care. So spread it the way we spread gossip and tea and everything else. We need people to know this is out there. Now, with the Payroll Protection Program and the CARES Act, we know that the NBA, Ruth Chris, all of these multi-million-dollar companies, they just got a check. They didn't have to submit claims and register. I'm going through all these processes. The grants are like 20, 30 pages, sign up for 5 websites. They didn't have to jump through hoops, right? The government literally just deposited money in their account and said, hey, good luck. What has been happening a lot is these companies are getting the money and then laying off the doctors. And that's not right either. But that's what happens when there's no accountability. And really, there is no accountability for government agencies in showing transparency of the use of funds. So we're doing what we can with what we have. And so in order to be a resource to the community, we need you to get that funding, that information out there, and spread the word. We see more people are starting free testing centers. Hey, MJ. And Beyoncé, who is from Houston, is doing a testing center this weekend. Look at my page and you will see the locations. So thank you, Bay, for doing that. But that's great. I applaud her. We need testing centers everywhere, not just one weekend. And so when we spread the word, the people who have the funding can back projects that can make it an ongoing thing. Also want to say kudos to Mary Susan Moore Medical Society. If you've never heard of them, they're African American organization of African American female doctors. They're giving out Stay Well kits. Look again on my story for when and where. Tomorrow, I believe, is the date, and you can go and get a Stay Well kit. Also, MD Newsline shared and I reposted. There's a new funding opportunity that came out, specifically funding for minority businesses. We know only 3% of black businesses who applied, 3% of CARES Act funding went to black businesses. Not nearly enough. I can attest to that. I didn't get any funding. So we're bootstrapping it, right? When they leave us out, exclude us, and which means businesses, minority businesses, need your help more than ever. And what you can do is let people know, hey, here's a trusted resource. I followed this company for years, and they can be a resource to you. Houston, a week ago, I said I was very concerned that people in long-term care facilities, nursing homes, were not getting tested. Today, there's a report on my Facebook page. News article came out. Oh, surge in cases in nursing homes. Come on, guys. There's no surge in cases in nursing homes. The people in nursing homes have been dying. They were not being tested, and now they are being tested, and now it is being reported. So we need accurate reporting. We need accurate information. Own up to the fact we didn't do what we needed to do. We neglected this population. We didn't test them. And the truth of the matter is several of them have probably died without being tested and went uncounted, right? So don't let your family member go uncounted because they were never tested, or they called one of those hotlines and they said, you don't need to be tested, stay at home, you'll be all right. No, we need to be tested. So home testing, we can mail you a kit, observe through telemedicine, you doing the test and confirm the results, or go to one of our drive-through testing centers. There's a drive-through testing center this Sunday, Mother's Day, at New Birth. Give mom that gift of making sure you know if she has it. That's in Atlanta. Hopefully we can have more partnerships in Houston in the upcoming few weeks and offer drive-through testing here. I know there are a few centers, but not nearly enough, right? With telemedicine, we have the capabilities to be testing way more people than we're testing. Anyone with a business background, you know about operations and the fact that there's a bottleneck. Every drive-through testing center is going to have a bottleneck. With telemedicine, you bring in hundreds of doctors from around the country testing patients, screening the ones who are high risk, sending them as a priority to drive-through testing centers instead of everyone and their mom going to the drive-through testing center. And the people who really need to be tested may never get tested because the wait is 4 hours. So I know some places are fast, I've heard, but other places it's really long. So telemedicine can help us get more people screened and tested and mail kits to people who need it. Someone said, just got tested today in the place I work for the staff. Didn't know there were home testing also. Yes, there's home testing. So that's all I have. If you have any questions, I'm happy to answer. Yesterday was my first day back in clinic. It went well. You know, it's scary. I'm not the only doctor in my office, so I'm coming into contact with other people's patients. My patients, came home, stripped out of my white coat, out of my dress, put it in the washer, taking the appropriate precautions, but it's risky. But it's what I have to do. I did see a patient, for a mental health issue yesterday, and I know it's Mental Health Awareness Month, and I just want to remind everyone to, if you have any mental health issues, to talk to a doctor, see a doctor. Won't share too many details, but my patient that I saw had been struggling with it for years and just had not gotten it worked out, and I hope that I can be a resource for her. And if you need a doctor, I hope I can be a resource for you too. What else do I want to share? If you have any questions, put them in. And last but not least, Rodox is looking for ambassadors, people who are passionate about the health of our communities and want to help spread the word. Email us your resume, email us a headshot, and we would love to have you on the team. So that's my COVID update, guys. Looking forward to continuing to be a resource and to be a servant leader. That's all I aim to do. That's all I aim to aspire, is to help people live their healthiest lives. I'm glad, I'm thankful, grateful God has chosen to use me. And if there's any way I can help you, reach out. All right, guys. Hope you have a wonderful day. Talk to you soon. Bye bye.